Hello everyone. We are the students of Vivekanand Education Society's Institute of Technology, currently studying in second year in the field of AI and data science. Today we'll be presenting a detailed analysis on the role of AI in medicine. AI is playing an increasingly vital role in medicine by improving patient care, enhancing diagnostics, and streamlining medical processes. Some key roles include diagnostics. So, AI systems like machine learning models can analyze medical images, for example, X rays, MRIs, etc., to detect abnormalities such as tumors or fractures more quickly and accurately than human doctors in some cases. Personalized medicine. AI helps tailor treatments based on a patient's genetic makeup, medical history, and lifestyle, improving treatment efficacy. Next is predictive analysis. AI can predict patient outcomes by analyzing data from electronic health records, helping doctors anticipate complications and prevent diseases before they develop. Drug discovery. Now, AI accelerates drug development by analyzing biological data and predicting the effectiveness of new compounds, cutting down the time and cost bringing new medications to market. Next is robotics. AI driven robotic systems assist in surgeries, making procedures more precise and reducing recovery time. Virtual health assistants. Now, AI powered apps and chatbots provide patients with guidance, reminders, and basic medical advice, improving accessibility to healthcare information. Now, AI and ML, that is machine learning, are revolutionizing medicine in several transformative ways, reshaping how healthcare is delivered and improving patient outcomes. I'll mention a few areas where AI and ML are making a significant impact. First is better diagnosis. AI helps doctors detect diseases faster and more accurately by analyzing medical images like X rays or MRIs and spotting patterns that humans might miss. Next is personalized treatments. AI uses patient data, that is genetics and health history, to recommend treatments that are more tailored to each individual, improving the effectiveness of care. Next is faster drug development. AI can predict how new drugs will work, speeding up the process of finding new treatments and bringing them to market quicker. Next is robotic surgery. AI powered robots assist in surgeries, making them more precise and reducing recovery time. Next is remote monitoring. AI helps monitor patients remotely with wearable devices, allowing doctors to catch potential issues early even when patients aren't in the hospital. In short, AI and ML are making medicine smarter, faster, and more personalized. Now we'll see how AI helps in diagnosis of diseases. First is it detects patterns in data. AI can identify subtle patterns in medical data like X-rays or test results that may be missed by humans, leading to more accurate diagnosis. Next is reduces human error. AI helps minimize mistakes caused by fatigue or oversight, ensuring consistent and precise analysis of patient data. Next is processes large amounts of data. AI can quickly analyze vast amounts of patient information, medical records, test results, etc., providing doctors with a comprehensive view of a patient's condition. Next is it aids in early disease detection. So AI can spot early signs of diseases, for example, cancer or heart issues, by analyzing patterns and trends, enabling earlier intervention and better outcomes. Now I'll hand it over to my friend Udayan.
Huh. So, what is a machine learning model? Well, an ML model, I'd compare it to a child that is particularly stupid, for a lack of a better word, a child whose cognitive abilities leave much to be desired. A child like this, a child who you'll show a picture of a dog and he'll say, "Oh, yes, this is a dog," once you show him the picture. But then you show him a different picture of a dog and he can't recognize that it is a dog. You turn the picture upside down, he can't recognize this as a dog. So, but again, you're his parent, right? You want him to succeed in life. So, what you're going to do is you're going to show him 1,000 pictures of dogs, of different kinds of dogs. So, the child can learn that, yeah, these are 1,000 ways you can see and identify a dog. So, he'll be able to identify dogs from now on. That is how a machine learning model works. The machine itself, it's not very smart. It can't make neural connections like we can. So we have to show as much data as possible. We have to feed him so much data that he cannot go wrong. So again, in creation of any machine learning model, there's the training phase where you feed him large amounts of data. in this particular sector it'll be x-rays or lab results or whatever. You're going to show him so many pictures that he can't go wrong in diagnosing a new picture. And this is the most important part of training any ML model. Like the training itself is pretty easy, but sifting through data, organizing the data, that's more important. That's the most important part of any machine learning model. Then obviously the model will analyze these images and it will make out patterns. It will see, okay, if the tumor is this big, then it is probably not uh, a gentle tumor, or if the tumor is in this spot, then it might not be that bad for the patient, etc., etc., all that stuff. The so the data will be labeled, right? So it will be, you'll show him a picture of a dog and you'll write below it that this is a dog. And so you'll give him 100 pictures of dogs and you'll give him 50 pictures of cats, and every picture of the cat will have cat written below it. And there'll be different angles, different orientations, different colors of cats and dogs. And so with that it'll figure out patterns on its own, that okay, this kind of nose has dog written on it, and this kind of nose has cat written on it, or this kind of ears has dog written on it, or this kind of paw has cat written on it. And that's how it will use this. Again, the this is a machine, right? It will all be broken into ones and zeros for the machine. So this machine has a huge advantage on any child. So yeah, that is how the learning pattern works. And then there's a prediction phase where you can give it any new patient data, any new picture of a cat or a dog, and it will identify that easily. So yeah, these are some types of machine learning models. There's supervised learning where all the data is labeled and you're controlling it. It's very laborious for the one training the model, but it's also very accurate. And then there's unsupervised learning where you can obviously feed as much data to the model as possible. For example, you have ChatGPT who's using all our data to train itself as it helps us. So you have that, and there's neural networks which are used for imaging and drug discovery. So, how ML works in diagnostics, right? So that is the main reason why you're here. So first step obviously will be collecting the data. As I've said before, it's very important that the data you collect is clean and it is as big as possible, the data set, because yeah, that is the most important part of training any machine learning model. 10 or 20 pictures is not gonna cut it, especially for something like medicine, where any mistake can have huge ramifications. You need hundreds and thousands of pictures to make it as accurate as possible. Medical images, patient reports, test results, all of that labeled. So that comes under pre-processing, where you clean and organize the data, you label everything, you make sure nothing is wrong, and then you train the model, which itself is not that difficult. You train the AI to recognize patterns, in whatever you're trying to train it in. For example, I want to train it to identify if a tumor is how bad a tumor is. So yeah, you have to train the model, and then I'll show him new pictures which it hasn't seen before, and it will be able to predict and diagnose with good efficiency. So real world applications, mostly artificial intelligence in medical imaging, where tumors, MRI and CT scans, like, you show them, feed them those pictures, you train those ML models with that, and then it can diagnose anything for you. Then a good example is Google's DeepMind, which developed an AI that diagnoses eye diseases from retinal scans, which is a huge advancement. And there's AI in cardiology, where again ECG reports, MRI reports, the reports where you go for the scan and they hand you the report, but they're not allowed to diagnose these. You have to show it to your doctor so he can diagnose it. But any machine learning model could do it for you. It could be much more smooth, much more streamlined. And there's Alzheimer's and Parkinson's detection, which is usually not identified early enough in patients, so it's usually not recoverable, but using it to detect early is again a huge step in medicine.
The future of AI in medicine is full of exciting possibilities. Imagine wearing a smartwatch that detects heart problems before you even feel symptoms. This is already becoming a reality now. AI is also making huge leap in genomic medicine, helping doctors create personalized treatments based on your DNA. And with AI powered robotic surgeries, doctors are achieving incredible precision in complex procedures. Plus, in rural areas, AI tools are providing fast diagnosis where specialists are not readily available. And challenges of using AI in this field. AI offers some impressive benefits. It's incredibly accurate, detecting tiny details that doctors might miss. It's fast, reducing the waiting time for critical diagnosis. And it's personal, helping doctors tailor treatments to individual patients. But there are challenges too. Protecting patient data is crucial, and AI models can sometimes reflect biases if they are trained on incomplete or unbalanced data. Another challenge, AI's prediction are not always easy for doctors to explain, and that can create uncertainty in critical cases. To sum it up, AI is revolutionizing healthcare by improving diagnostic accuracy, enabling personalized care, and enhancing overall treatment outcomes. By helping doctors detect symptoms earlier and manage data more efficiently, AI is playing a crucial role in saving lives. Of course, challenges like data security, bias, and transparency still needs to be addressed. But one thing is clear, AI is not there to replace doctors. Instead, it's empowering them with smarter tools, better insights, and greater precision. Thank you.